Okay, finally, welcome to Caregiving Cafe, everybody. Today we have the pleasure of having Gene Rodriguez. He will be speaking to us about Medicare in plain English. Medicare is a very confusing program. I'm very grateful for Medicare because it has helped my husband in his care, but there is a lot to learn. So Jean is going to enlighten us on that topic. So thank you, Jean. I'll let you introduce yourself a little bit more, and then the floor is yours. Thank you.
Hello, good morning, everybody. Thank you for having me. Thank you, Dora and Lynn, for having this. Can you guys hear me okay?
We can hear you fine.
Okay. And then I guess, just a little bit of background about me. I am a independent broker. So I live here in Buda, Texas, just south of Austin. And I help a lot of clients with different choices of their Medicare options. And I did put a presentation together. If I could get to share my screen, Dora, I don't know if you can let me share my screen on that so I can start that.
So
And
you should be able to share, Gene.
screen. Let's see. Okay. Let's see here. Okay, let's see. Can you guys see this?
Yes.
Okay. So you see my okay, so basically this is what I put on my business cards here because I do believe that sharing knowledge empowers better decisions. We all need to share knowledge to each other because everyone has different experiences. Hearing everybody's experience with their caregiving, I myself personally have gone through this also to an extent of putting my father in a nursing home, and it was gut wrenching to see how the progression went from independence to just loss of dignity. And these are the things that we face as as the circle of life goes around. So today I'm just going to go over basics. And yes, you're going to have some information that's going to be helpful and other information that's going to be a little bit confusing, and we're going to have to navigate through that. Do you see my the next slide?
Yes.
Okay. So what is Medicare? Medicare basically is a federal health insurance program for U.S. citizens and legal residents. It's paid by our taxes as we work. It's individual health insurance. Medicare is not free. It's not a family plan. It has nothing to do with Social Security besides charging your Social Security. And it's not Medicaid. A lot of people get confused with Medicare and Medicaid. Medicaid is through the state. Through the state, every state has their own different type of Medicaid program. They vary from state to state. Eligibility varies also from state to state. Yes, you can have Medicare and Medicaid, to which we call dual eligibility. You get a whole bunch more benefits. Medicaid is based on your finances, has nothing to do with your medical history. Okay. Who can get Medicare? U.S. citizens and legal residents. Okay. Just because you're a U.S. citizen, of course, you have to qualify. You have to do some qualifications to get Medicare through Social Security. Okay. That's how we get Medicare started, is through Social Security. You first, one of the qualifying is age 65 older. If you're younger than 65, you have to have a qualifying disability. Um, any age with a diagnosis of end-stage renal disease or ALS does qualify you for Medicare eligibility. Can you have both Medicare and Medicaid? Yes. What dual eligibility, they work well together. There's plans out there that do offer a bunch more benefits because of Medicare and Medicaid. Medicaid through the state they have different levels and they can pay for the Medicare if you qualify. But again, Medicaid is based on your finances. Here in the state of Texas, if you make less than $1,200 a month, you can qualify for Medicaid. If you make over that on your gross income from your pensions or from your Social Security, you will not qualify. Okay.
You did? Uh-oh.
Think we lost Gene, but he will probably be joining us again here shortly, I would assume.
Yes.
I guess in the meantime, I'll just say I was surprised that I think that sounds like the numbers went down. Did he say 1,200 per?
Yeah, he said 1,200 per month.
I thought it was 22. I
Oh,
wonder if that
did I lose you guys?
I think that's your total assets, Dura, but I'm not sure.
Yeah.
Are you back?
Yeah, I'm
Gene?
back.
Okay.
What happened? I was just going through it. What
You dropped off. Yeah.
we lost
what
you.
was the last thing, what was the last thing you guys heard?
Medicare,
The income limits.
yeah, income limits.
Income limits to Medicaid?
Uh-huh.
Okay. All right. Let's see if I can get this going again. Hang on.
You had mentioned $1,200 per month or less.
Yeah, for Medicaid. That's for
Medicaid,
Medicaid.
Yes. Now, and
Yeah.
but you remember that 2,000 or 2,200, something like that. I believe that is assets, but for Medicaid, but I may be wrong.
For Medicaid, they're always changing they're always upgrading the limits. As far as right now, a good rule of thumb, it's I've heard it's going up to 1,300, but basically it's based on your income, what you're bringing in as far as your Social Security, any pensions. If they go over $1,200 to $1,300 a month, then you will not qualify for Medicaid. At least for Medicare, to cover your Medicare. Okay. They do base it on your finances. Medicare, there is no medical history. You're guaranteed coverage. There is no qualifying besides being 65 or older or the disability that qualifies to get Medicare. Okay. Let me see if I can, I don't know if I can share this again. Let's see. Okay. All right. You guys see my screen?
Yes.
Trying to share.
Okay. Okay. All right. So this is the question that I get a lot of, is working past 65, you may delay the enrollment to your Medicare, your Part B, if you're working. Now, the stipulation to that is that you do have to have an employer that has 20 or more employees, and it does have to be a coverage that is considered credible to Medicare. If you do not meet those, then you should get into Medicare as far as if you're working to get your Part A and Part B. Okay. The other thing is the spouse. Okay. So if you have a dependent, they're able to, and your dependent turns 65, they're able to delay their Medicare as long as they're dependent on your insurance through your employer. Okay. All about these delays is because Medicare will allow you to have your employer insurance so that you don't have to pay for your employer insurance and your Medicare. Okay. Once you take Medicare, any part of Medicare, Part A or B, you will no longer be able to contribute to HSA, Health Savings Account.
What is Part A and Part B? What does that mean to me?
Yeah.
We're gonna Yep, I'm gonna get right into that also as far as getting to that. It's just the basics that we're going through to make sure that you guys get a foundation of that. Um, Medicare will not cover anybody but you. They're individuals. So if you have a dependent that's on your insurance and you're turning 65 and your dependent is not, then it's best to stay with your employer. I come across that quite a bit where we have to take everything into consideration and this person gets excited about Medicare, but then when I find out that their spouse is on and they still have a year to go, I tell them you have to wait. You have to keep on paying the employer insurance because your dependent will lose insurance unless you want to find them their own insurance.
Dean, I
Okay,
have a question. I have a question.
go ahead.
From what I understand, isn't it preferable to join Medicare when you first become eligible? Otherwise, there is a penalty that follows you for life.
And we're going to get into those penalties also towards
Okay.
the end, but
Okay.
you do have options. Don't get scared about the penalties. You do have options. This is the reason why I wanted to go through if you're still working, because you will avoid that penalty if you're still working. But we'll get into the penalty phase as far as what that's about. So
Okay.
the different parts about original Medicare, you have two different parts, Part A and Part B. Part A is your hospital. Part B is your medical. Okay. So the Part A you're entitled to. There is, if you meet the Part A requirements as far as it's 10 years basically of employment, then you do not have a premium for Part A. However, Part B, there is a premium. Everybody has a premium. It just depends on your income level on what your premium is going to be. The base one is $164.90 per month. They take that right out of your Social Security. Okay. So Part A covers your care, the meals, your prescription drug and medical supplies used during an inpatient stay. Okay, because Medicare covers prescription drug. However, if you're in the hospital, they will have a portion of that. Operating room, recovery rooms, lab tests, some blood transfusion. When they some, I think it's like 4 quarts is what they will cover up to. They do have hospice care, including medications to manage symptoms and pain. Part-time skilled care for the homebound after a qualified inpatient stay. What that means is you have to be qualified.
Yes, again.
Boots. Sweater. Oh, no, it's
And you've added these little
so cute.
charms and things.
Those are stitch markers.
Oh, I thought that was part of the,
It seems like we're stopping again.
okay,
We stopped again.
okay, yeah.
Okay, hang on real quick. I don't know why it keeps doing that.
He has a sweater like that.
Let's see.
Oh, but you could put her in there. Yeah, they're adorable. I could use them. My nose is cold. My fingers are freezing. So,
You turn the air conditioner.
Okay,
let me see if I
you
can.
guys see that?
Can you see it?
Yes.
Okay. So keep in mind with all these coverages, they only cover at 80%. That's how Medicare works. It's 80-20. So it's 80%. And 20% is left to the individual. Okay. Your Part B medical insurance. Sorry?
Part A and Part B, 80-20.
Yeah, no, they're both 80%. 20% is left to the individual.
Right. Part A
Yeah.
and Part B.
Medicare only covers 80%. Yeah. A and Part
Both
B.
Part A
Correct.
and Part B, correct? Yeah.
They both are.
Yeah.
Correct. Yes. So your Part B covers doctor visits and outpatient care. Doctor visit, including when you're in the hospital, annual wellness visits, clinical laboratory services, X-rays, MRIs, CT scans, physical therapy, diabetes screening, mental health care, durable medical equipment, okay, like wheelchairs and walkers, and ambulatory surgical centers services. So like emergency room services. All of this is covered, but remember, it's only at 80%. You will be left with 20%. So let's talk about the Part B medical insurance, because that's what you're paying for. You can have Medicare Part A only if you're working and you have employer insurance. If you do not enroll in Part B, this is very important. When you get to Medicare eligibility, you will automatically be entitled to Part A. However, you need to roll in Part B. It is a monthly premium and it's adjusted for income. You can't be denied coverage. Coverage is nationwide. Anyone that accepts Medicare. There is a premium penalty unless you qualify for a special election period. So you do have a penalty. Okay, so Medicare doesn't cover everything. You will have out-of-pocket costs with no limit. Now, this is the tricky part about this, is that there's some individuals that just want their original Medicare and they don't want all the other hoopla. They say, oh, I'm just going to stick with original Medicare. Well, original Medicare has deductibles. Like Part A, there's like a $1,500 deductible. Part B, it's like $226. And the Part A deductible renews every 90 days. So if you're in the hospital and then 4 months later you go back in the hospital, you have that deductible again. There is no limit to their deductibles. They renew. They do not cover prescription drugs as far as Part A and Part B. There's no routine dental, vision, or hearing care. There's no glasses, contacts, or hearing aids. They don't cover that. The biggie one, of course, is they do not cover long-term care or custodial care, meaning bathing, eating, or dressing. They don't cover that. Medicare does not cover that. That's where you have to get your supplemental insurances, or you qualify for Medicaid. They do not cover excess charges by the doctors who do not accept Medicare. If you go to a doctor that does not accept Medicare, they're not going to cover the charges. There are some instances where they'll cover you outside the U.S. on an emergency basis to get you back to the U.S. There's a small benefit for that. You do have two options of two ways to go for coverage to cover that 20%, because that's the biggie. You just don't know when that 20% is going to hit you. God forbid you go into the hospital and you only have Medicare, that 20% can be thousands of dollars. So you do have option one. You can take either both or just one of them. You can have original Medicare and you have your Part D, which is for your drug plan. Or you can have your original Medicare with your Part D and a supplemental, which we call Medigap. It's a Medigap plan that helps pay for that 20% out of pocket. There's several different plans on that we'll go over. Option two is Medicare Advantage. That's what you call Part C. Part C incorporates A, B, and D usually. There's some Part C plans that do not have a prescription plan. Those are the special case ones that we always review. But normally, they all cover, Part C has A, B, and D all in there. You have additional benefits like vision and dental coverages in the Part D plan. That's your Medicare Advantage. So let's go into Part D. Part D, prescription drug coverage. There's two ways that you can get it. You can either get it standalone or you get it from Medicare Advantage. The reason why some people get it standalone is because they either have a Medigap plan or they just want original care and a Part D plan. That's what they want. In a Part D prescriptions, there's tiers, formulary tiers, 1 through 5 tiers, and as the tier goes up, based on the cost, the cost goes up. So I highly encourage everybody that know your tiers or at least review your tiers. You can either do that with looking them up as far as Google is a great resource, or you call your insurance company and you find out what tier is this drug on in theirs, because every plan varies a little bit here and there on tier structure. One plan might have a drug as tier 1, another plan might have a drug as tier 2. They vary from plan to plan. So in general, the lower the tier, the lower the cost. So if it's a tier 1, tier 2, a lot of plans right now have 0 copay. If it's a 3, it's like $47. Okay. You may have deductibles in your Medicare Advantage. Be wary of that. Don't get sold by the bells and whistles. This is what I always say. I always talk about the bells and whistles last. The dental vision hearing and the over-the-counter the benefit is the last thing I talk about. The first thing I talk about is let's go over the tiers. Let's kind of review your formulary, because I want to compare the plans of what gives you the better coverage instead of talking about the bells and whistles, because that's what's going to hit you month after month. That deductible is the sneaky one. They always put that deductible in the prescription drug plan. It has nothing to do with your medical. So everybody's affected by this if you do hit this what we call donut hole. Let me explain this donut hole, because there's a lot of confusion. Okay, so during the year, you'll have either your annual deductible, then you go into your initial coverage. Annual deductible basically is if your Medicare Advantage plan has a deductible of, say, $300 on your prescription drugs, you have to pay that $300 first before you start getting into the initial coverage. The initial coverage this year is $4,660, sorry, $4,660 retail costs. This is important. It's not what you're paying, it's what the retail cost of the drug. So a lot of people get confused because they say, Gene, I pay like maybe $50 a month. How am I in this donut hole? Well, it's because of your retail cost of the drug, all of them together. A big one is Jardiance. That one is like $800 a month, and people are paying around $47 until they hit the donut hole. So all your drug costs, retail costs, once they hit that $4,660, you go into the donut hole and you'll pay 25% of the retail costs. So that's why a lot of these drugs at that time will cost a couple of $100s a month. What do we do for that? You talk to your doctors for samples. You try to find a discount program for that drug, or you find an alternative. But every drug plan has this donut hole. We can't get away from it, unfortunately. Once you reach the other side of the donut hole, which is $7,400 in your retail cost, you go into catastrophic coverage, which means that you'll pay like 5% of the drug, or maybe even $10 for the drugs. It just depends on what that prescription is. The coverage cycle starts every January 1st. So I've had a lot of people trying to get around this, and I have to explain to them that no, it follows you. So if you change plans thinking that you're going to start over with the drug coverage, the only thing that's going to start over is the deductible. So if you change from one Medicare Advantage plan to another, and if it has a deductible, you're going to have to meet that deductible again. So keep that in mind. A lot of other Medicare Advantage plans have 0 deductible. You don't have to worry about a deductible. However, once you hit that coverage gap and you're thinking, I'm just going to change the plan, it follows you. So it only starts by calendar year. Okay. Now, just hitting on to Medigap plans. The Medigap plans, you have to have your parts A and B in Medicare. And the Medigap plan cannot be used in conjunction with the Medicare Advantage plan. You can't have 2 plans. It's not allowed. I catch it all the time. This is the tricky part about it, is that insurance companies will take your payment, but they will not stop, they won't stop you from paying each month, even though if you have a Medicare Advantage plan. When I come across these scenarios, I tell them you're due a refund, and these insurance companies will refund you the money of your premiums if the date you started a Medicare Advantage plan and you stay on the Medigap plan for my record is I think somebody stayed on it for 5 years and they didn't know. And when I came across them, we got them a $7,200 refund because they paid that premium. There's 10 plans and they go by letters A through G, and they all vary in different coverages. Just keep in mind, G is the best one out of the plans. It only has a deductible of $226, and then you're 100% covered after you meet that 226. However, there is no prescription coverage. You will have to get a prescription plan in addition to your Medigap plan. So I always say you're going to have 3 costs each month. It's a great plan. Don't get me wrong. I don't want to be negative about it, but it's a good plan. It doesn't have any networks. It goes to any provider that accepts Medicare. You can use this plan, but it's not for everyone because of the cost. They do not stay stagnant. They go up almost every year when you're aging. So you have 3 costs to a Medigap plan. You're paying your Medicare, the Part B, you're paying your Medigap plan premium, and you have to pay for a prescription drug plan also. So those are 3 payments that you're doing every month, whether you use the plan or not. Keep that in mind. That's the biggest difference. If you're able to sustain those 3 premium payments because you like the flexibility of the plan, then that's a good fit. But however, a lot of individuals, they get out of these plans later on in years because that premium, just for the Medigap plan, say for instance, in your late 70s, that thing could be over $300 a month just for the plan. And then you're paying your $164 for Medicare. So you see the differences there. Okay. So again, like I say, premiums vary for the same coverage. They're all the same. All the plans are standardized. Doesn't matter where you are or what company you want to get with as far as a private insurance to pay your premiums. They're all the same plan. There is no medical underwriting up to 6 months after you're enrolling in Part B at the age of 65 or older, meaning that once you start Part B, you have 6 months that you can enroll with underwriting. After that, you do have underwriting, and underwriting can determine if you're denied or if you get a higher premium because of your medical history. Okay. They're nationwide coverages. They have no provider network. As long as they take Medicare, they'll take this plan. It's guaranteed renewability as long as you're paying your premium. Okay. You must pay your Part B premium also. If you stop your Part B premium, this plan will stop also. Okay, that's the Medigap. So Medicare, going back to Medicare, it's not free. You do have a premium. It's a fixed amount that you pay for coverage monthly. And it's determined on your income. If you're past, I believe, 90,000 a year, you're going to pay higher than 164. Deductibles. It does have deductibles for Part A and Part B that I said before. You do have fixed copay amounts. So just to give you a definition of the copay and co-insurance, a lot of people think that they're both the same. They're not. Copays is a fixed amount that you pay at the time you receive a covered services. Like if you go to a specialist, it's $40. That's your copay. Okay. Then you have your co-insurance. And this is where I was telling you, your co-insurance is by percentage. 80 is Medicare, 20 is your percentage, 20%. Alrighty. There is late enrollment penalties. Medicare Part A, if you do not get Medicare Part A when you turn 65, and they do give you a grace period of 3 months before your birthday month and 3 months after your birthday month. So you have a total of 6 months to get your Medicare. So after that 6 months, if you do not get it, or 7 months, I'm sorry, 7 months. If you don't get your Medicare, you will have a penalty, and it's 10% of the Part A premium. What that premium is based on your income. Part B, there is a penalty also. This is the one that catches some individuals because they're working and they just didn't get Part B because they have their employer insurance, and then when they retire, they forget all about it, and they don't get their Part B. You will have a penalty of 10% of the month premium for the full 12 months period enrollment is delayed. So what that means is it's going to be 10% of a year's worth of Part B premiums. And if you look at that, the rough number is going to be like $197 penalty. And that's the one that will stick with you as far as the Part B. Part D, this is where it catches a lot of individuals. This is the one that will stick with you for life. Now, Part D is your drug plan. If you decide to just have Part A and Part B, even though you do not take prescriptions, you still have to have a prescription plan. They're as low as $6 per month to up as they're as high as $70 a month is what I saw last. So I come across this all the time where individuals say, I don't have a prescription plan because I don't have any drugs. I don't take any prescriptions. Well, it doesn't matter. You do have to have a prescription plan. It's 1% of the average premium for each month. So to put it in context, the national average, it's about 33 cents a month is the penalty. And I've come across people that haven't had Part D for years, and we have to multiply that. And I said a rough estimate is going to be, this is what you're going to pay per year because they like the payment per year. You have 63 days after you retire, and you want to go full Medicare. You have 63 days to get your Part D enrolled. It's not the 6 months. That's for Part B as in boy. But to Part D, you have 63 days. Okay.
If you retire before you're 65.
Now you have your initial enrollment period. Sorry?
If you retire before you're 60.
I'm sorry, say again.
If you retire before
No,
you're
remember, the only way to get
65,
if you're retired before 65, then you have to wait till 65 to get Medicare,
Thank you.
right? This is just for people that are working 65 plus for working. If you're retired before 65, you still have your regular insurance that you're paying. You just wait for 65 to get your Medicare.
Then you have 63 days after you turn 65.
No, ma'am. That is when you retire. If you're 65 or older working and you retire, you have 63 days to get your Part D prescription drug plan. If you're turning 65, you'll have, like I said here, the initial enrollment period. You have 3 months before and 3 months after. So you have a total of 7 months to be enrolled in Part A and B. Okay.
okay, sorry. That's you have the 7 months to enroll in Part A and B, but also for Part D.
For yeah, once you get your Part A and B, then you get your Part D. Correct.
Yeah, you A and B first, and then your Part D.
Correct.
And you still have to get your Part D within those 7 months, or you have 63 days after you're 65 to get your Part D.
Well, okay, so worst case scenario, you wait till the 7th month to get into Medicare, then you have 63 days after that.
Okay, thank you.
It's either 63 days. Yes, ma'am. It's either 63 days after you retire and you have your Part A and B, or you turn 65 and you get Part A and B. The clock starts ticking after the start date of Part B. You'll have 63 days to get a Part D to avoid the penalty.
Thank you.
Okay. Yes, ma'am. Okay, so then you have your annual enrollment period, which is getting ready to start October 15th to December 7th. Though anything that you enroll in October 15th to December 7th is going to start January 1st. You can switch or drop a Medicare Advantage plan or a Part D plan. You can switch from a original Medicare to Medicare Advantage, which is the Part C, or vice versa. You can drop everything and just have your original Medicare. So you have a lot of different options that you can do in annual enrollment. So there is a little bit caveat here for Medicare Advantage. It's called the Medicare Advantage Open Enrollment. So what this is if you've chosen a Medicare Advantage plan in the annual enrollment period, Medicare understands you need to kick the tires to it. You need to kind of try it out. They'll give you 90 days, January through March 31st, to try that plan out. And if you find that it's not to your liking, you find out that, oh, my doctor really doesn't take this plan. Or you find out, whoa, I didn't know that there was a deductible. I don't want to be stuck with this. You can make one more change. You're not stuck for the year. You can make one more change before March 31st. It's just one coverage change allowed. They won't let you change many times. It's only one coverage change allowed. There are special enrollment periods. Okay. So I think this is what we're talking about a little bit more, and we could get into this, is that working past 65,
Yeah, you can.
you have up to 8 months. You have up to 8 months to enroll in Part A and B. Okay.
Yeah.
Then you have 63 days to get a standalone Part D plan once you enroll in Part A and B. Does that answer that question a little bit more?
Yes. Now,
Okay.
we wanted to just confirm, if you sign up for Medicare Advantage, are you in the future able to switch back to Medicare Basic, Medicare, Original Medicare, just A and B, and get out of the Part C, get out of the
Correct.
Advantage? Okay.
Yes, that's
You
correct.
do
Yes,
that
you
at the
can.
next
You do.
re-enrollment period? Like you have to wait it out? Like if I decided in June I didn't like the Part C, I could, at the re-enrollment period beginning in October, then I could change it then?
Yes, you can do changes like that. They allow changes for that.
Mhm.
As far as in your annual enrollment, if we go back up here, you can switch from a Medicare Advantage plan to another one, but you can also switch from Medicare Advantage to original Medicare
Mhm.
in your
Yeah.
annual enrollment. They'll allow you to do that. Okay.
And I wanted to just throw this out there because
Okay.
I do this with my mother. She was with Kaiser Permanente in Maryland and California, but Texas does not take it. So she was in I guess it was an advantage. So we had to switch back. That's how I found out that you could do it. She went back to the original Medicare in Texas, and then the doctors saw her that.
Cause I was told otherwise.
Hey, that's a great
If you
question.
move
So
to
when
another
you gotta,
state, you can
Right.
change coverage. So
you have to change coverages. This is the reason why. Medicare Advantage plans are by local area, your zip code in your county. If you even change a county, and you have to check to see if that county is covered. Say for instance, I have somebody from Dallas that moves down here. We need to change their plan because it's not going to be valid. They do give you 8 months to stay on that plan because they understand there's grandparents. Medicare recipients are grandparents. They'll go to a different state or to a different place to take care of the grandkids. So they give them a grace period of 8 months throughout the year to stay on the plan without changing and use it. However, once they start using the plan, like say for instance, they see a local doctor there, then the clock's ticking. Then the insurance company knows that they're in a different area and they're going to honor the claim. But once that 8 months hits, they're going to send a letter and say, we're terminating the plan. You have to get a local plan. Okay. So I get that a lot, to where people move from out of state the first thing we need to do is change the plan. You do have a special election period for change of address or change of residence. Okay, change of residence is what it is. Great question. I like that question. Okay. So going into Medicare supplement open enrollment. Supplement open enrollment lasts for 6 months when you are once you get your Part B. So if you're 65 or older and you get enrolled in Part A and B, you have 6 months to enroll in a Medigap plan with no underwriting. Okay, that's the only time you will not have underwriting. After that 6-month period, after you enroll in Part A and B, there's underwriting. Okay. Let's see here. You could be denied coverage, or you could be a higher premium based on your health history. And every state is different for open enrollment laws. Here in Texas, we do honor that 6 months, and you can enroll throughout the year, any time of the year for 12 months. You can enroll in a Medigap plan, but it's underwriting. Okay, keep that in mind. Underwriting is what you'll go through. The only time you do not have to go through underwriting is when you turn 65, getting parts A and B, or getting parts A and B, correct. Other resources I always like to share is, this is a wealth of knowledge, is the Medicare.gov. Medicare.gov will answer, well, it's a great resource. I use it myself. It's a great learning tool. You can easily navigate it. You can create an account on there. Or you can call the 1-800-Medicare. Okay. You do have programs that help if you qualify. There's another program in Social Security called Extra Help. Extra Help is based on your finances again, and they mainly pay for prescriptions. But however, they also pay for that penalty. So this is a big little tip here that I come across individuals that are paying this penalty. I tell them, are you making less than $1,800 a month? And they'll basically say, yes, I make it less than 1,800. Okay, let's get you qualified for this Extra Help. And if you do get qualified, they will pay that penalty, that Part D penalty. And they also lower your prescription costs. They lower the prescription costs anywhere from $3 to $5 for certain tiers of prescriptions. Okay. So I guess the best thing to do is let's go over your questions, because I know this is a lot of information. And I want to hit on what mainly gives you concern, because I had to cover every area of enrollment and different forms of coverage for Medicare. So I would say, give me some focus and let me see what questions you have, so that we can kind of focus on that area.
Anybody? Questions?
I had a situation with mom where she was hospitalized and we were trying to get her into physical rehab. And the doctor said that because she was on the Advantage plan, it was harder to qualify for that.
Okay. So that's a yes and no. Let me tell you why. Medicare Advantage follows the Medicare. They say if it's medically necessary, then Medicare will cover it. So will the Advantage plan. The reason why the doctor's probably saying that is because of the network. It could be the network. It could be prior authorization, because they want to make sure that Medicare is going to cover it. So yes, some plans will give you, a couple of challenges, but you also do have appeal process for prior authorization. Understanding the situation, she has you said your mother?
Yes.
Yeah. You said your mother had a Medicare Advantage plan, and the physical therapy was not being accepted because why? They didn't take the plan, or
Physical rehab.
Physical rehab at a facility?
Yes.
Okay. The limitations on plans are networks and also, but there's ways to get around that. Now, the way they give you about 20 days. Most plans they give you 20 days. However, if you do need an extension on those 20 days, that's where your doctor has to get involved and say, no, they need to stay in. They need more physical therapy. So getting it approved is really the diagnosis on the doctor also. They have to follow certain protocol on fitting the right diagnosis for the need. It could be, and there's so many different factors on that as far as the Medicare Advantage plan, but mainly they follow in line with Medicare. If Medicare approves it, then they will cover it.
Okay.
And may I also point out that when we talk about coverage, Medicare coverage, I think, but I'm not sure if it's always 80-20, because we don't have, my mother only had the basic, but when I asked at the ER if Medicare covered the visit, and that was told, yes, 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 yes. Well, I should have asked, does it cover it at 100%? No, it covered
No.
80. We were slapped
Yeah.
with a 20%, which is okay.
Yeah.
I mean, she could, thank God, but you know, it's like you need to know, you need a qualifier. Yes, it's covered. Then I get a bill. Yes, it was covered, but not 100%. Yeah, yeah. So rude awakening.
Correct. Yeah, that's correct. Medicare is only 80%. That's why I always say it's the 80-20 rule. Medicare is 80%. You're left with 20%. That's why you have these two different options that you can do to cover that 20%. One is going to cost you per month to cover that 20%. The other option two is usually at zero premium. It costs you nothing to have a plan per month. The only time it costs you is when you're using the plan, like a specialist or in hospital stay. You will have co-insurances and co-pays. Okay. However, just to have the insurance doesn't normally cost you anything. It depends on your region and your area. Some areas do have a cost, in other areas, because they're rural, they only offer plans that have a small cost of $37 or what have you per month to have a Medicare Advantage plan. While most urban areas do not, they offer a lot of plans that do not have they have a zero premium per month. You're still paying for your Medicare, but you don't pay for your Medicare Advantage to have it.
So Adelia,
Great question.
it's like residential rehab, post-acute hospital after shit. So they wanted to discharge her from the hospital to a rehab facility after the stroke. That's exactly what the situation was with my mom.
Same.
So, okay.
And I was told the same.
Say that again. I'm sorry.
The replacement plan did not allow for as many days as traditional Medicare would have.
Right.
I was told that too.
All right.
Right, but you got 20%. That's the 20%. So yeah, there are give and takes with each Medicare Advantage plan that they do have limitations. Since on Medicare, they don't cover custodial care. They won't cover long-term care. However, a lot of plans will cover up to like 100 days of to stay in the hospital. Has to be medically necessary.
All right. Thank
Great
you.
question.
Any questions, comments?
Can,
Yeah.
quick question, can Medicare be,
Do we lose them?
Yeah.
Yeah.
Oh, gosh. Okay.
So he's
hold
here.
that
he comes.
question. He's coming. Okay.
He'll be right back.
You there?
Yep, there we go.
Are you guys there?
Out. So
Yes.
it's typically staying there.
Yeah.
Yeah.
So,
Yeah.
Can you hear us, Gene?
Are you guys there?
Yes.
Yeah,
Can you
yes,
hear
I can. Go ahead. What was the question? Uh-huh.
Can Medicare be used as a secondary insurance? Or is it,
Medicare is always going to be, sorry?
go ahead.
Okay, so the way it works is Medicare is always going to be your primary, okay? The secondary is your Medicare Advantage or your Medigap plan. However, they become your primary in claim processing. That's what Medicare wants. They don't want to deal with the claim processing. That's why when you get a Medicare Advantage plan, you go through that network of that plan, of that private insurance. Like say, for instance, it's United or Humana or Aetna or whichever. They have certain networks, certain agreements with doctors and hospitals. You have to be aware of that. Make sure you understand, okay, not only is my primary doctor in network and my specialist, but what hospital is the hospital that I want in network? You have to do your due diligence and ask the agent that, or ask the hospital itself or the plan itself. You can always call the plan itself and ask them, is this certain hospital in network? Because you do not want to have out-of-pocket costs of an out-of-network hospital. That's the biggest one that catches people all the time, is that, hey, I have all these crazy costs. I thought they were supposed to take care of it. Well, it's an out-of-network hospital, and the unfortunate part is you will be responsible for out-of-network charges. So
Even if it's.
using Medicare only,
Yeah.
sorry?
Even if it's an emergency, I mean, what are you supposed to do whenever they're loading your loved one into an ambulance? Tell them which.
Yeah, if it's an emergency, they're not gonna take you. They're still gonna take you. You're just gonna have higher costs.
Okay. So,
Yeah, the question is not getting service. The question is, what are you gonna be paying? They'll take you no matter what. But what are you gonna be paying? Are you gonna be paying out of network, or are you gonna be paying in network?
Now,
Okay.
Gene, I thought
Oh.
that when it came to ambulance services, if you're unconscious, unable to tell them where to take you, that the any additional fees would be waived because of an emergency.
Now we're talking about ambulance. Okay. So ambulance, yes, ambulance, I would recommend if you're ever going to call an ambulance, you need to go to the hospital. Okay. So if you don't, because in the past, many, many years ago, ambulances were being used as doctors, basically. People were calling ambulances for every little thing. And now Medicare cut back on coverage of ambulance. So you do have copays with Medicare insurance or Medicare Advantage. You will have copays. They're usually typically about $250. An ambulance ride is a copay. However, if you do not go to the ambulance, if you don't go to the hospital and you called an ambulance, you are potentially leaving yourself open to a bill from that ambulance, because then they can't collect because they never took you to the hospital. They're going to bill you directly. I've had some clients that told me, I got this $1,200 bill. I thought I was only supposed to pay $250. Did you go to the hospital? No, I didn't. That's why. There's very stipulations in there that, if you don't get picked up by an ambulance to go to the hospital and they just treat you on the spot and leave, then you're potentially responsible for that bill. Does it happen all the time? Sometimes it doesn't. Sometimes it does. Just depends on the service of the ambulance service. Some of them do bill directly, and some of them only take what they can get from Medicare and eat the rest. That varies from company to company. But as far as being unconscious and going to a hospital, and it's an out-of-network hospital, it's not a question of getting treatment. It's a question of what cost are you going to be receiving. The question comes in is if you're out of state and it's an emergency and they don't take your plan anywhere in there, they will still take you and give you coverage because it's an out-of-state emergency. Okay, because some states, some areas don't even accept the plan, don't even have the plan available in that county. Remember, it's based by county and zip code, and some counties and zip codes don't even offer. Like, for instance, perfect example, here in Austin, we don't have Cigna. There is no Cigna Medicare Advantage plan. So if a person from Florida comes here to visit, and they're on Cigna, and all of a sudden they have an emergency, they're still going to get coverage, but at a higher cost. That's where I think that that question comes into mind, is that you still will have coverage on emergency basis. But you may have potentially higher costs, out of pocket costs. Great question.
Okay, last
Anybody else?
Please, you got him here, so ask.
So if I'm carrying my husband on my insurance and he's gonna be 65 in 2 or 3 years. And he registers for Medicare, do I still keep him under my plan?
Okay, so let me, you're younger than him, correct?
Yes,
Okay, and he's a dependent on your insurance.
yes.
Perfect scenario. He's gonna become 65. He gets off of yours, so you don't pay for him anymore because he's gonna have his own plan. If it was reversed, where you're turning 65 first and he still has a year to go, that's, remember I was telling you, then I do not recommend taking Medicare, because he's going to lose his insurance because you're the primary. But since you're reversed and he's turning 65, you're actually going to save a lot of money from having him on your dependent insurance, because you're basically paying quite a bit to have him on your insurance. That's usually the typical scenario, that when you have a dependent on your insurance, you're paying a lot of money to have them on your insurance. So when they turn 65, you take them off your insurance, he gets his own, your premium is going to drop dramatically because it's only you through an employer. Employer insurances work that way. They'll cover you, they'll give you a low premium, but then when you put a dependent on, that premium shoots way up, and what's way up, it could be $300 to $500 to have a dependent on there. It just depends on what kind of rates the company gives you.
So doesn't that depend on whether a company's paying for it or not? Because some companies will pay dependents.
Yeah, I mean,
It depends on your company. Yeah.
he doesn't, yeah. We don't have a premium for him or me. It's an antiquated
Are you
plan.
with the state then? Are you with the state?
No. It's an antiquated plan that, I mean, I have to cash pay my annual visits, but they pay everything else.
Okay, so yeah, it's every company's different. Every company's going to have a different scenario, but normally, the way it's usually set up, if you're paying for your insurance dependents, you're paying more. So the other thing you have to keep in mind also, employer plans have what? Deductibles and maximum out of pockets. Medicare Advantage takes care of the deductibles of the Medicare. Medicare has a Part A deductible and a Part B deductible. Okay, the Part A is around $1,500. They're changing the number for next year, but it's around $1,500. The Part B is $226. Okay, Medicare Advantage takes care of that. So, perfect scenario. You go see your primary doctor. If you go see your primary doctor and you only have Medicare, you will have to pay the doctor a certain amount. It depends on the office. Some of them collect $150. Some of them want the whole deductible. They want the $226, and others, they'll just charge you their office visit of $50. This is the primary doctor, because they don't know if you've reached your deductible or not. All they see is deductible not reached, right? They don't know how much you need to go. So that's the scenario that you have with original Medicare, is that you have deductibles to meet. Medicare Advantage wipes that out. They cover that. When you go see your primary doctor, it's zero copay because you have no deductible. They're taking care of the deductible. The only thing that you have in Medicare Advantage is your maximum out of pocket, meaning that, say, for instance, you have a $5,000 maximum out of pocket. Once you reach $5,000 in a calendar year, then your plan goes 100%. It covers everything 100% medically necessary and approved by Medicare. Medicare does have no limits. They keep on regenerating the deductibles. After 90 days, that hospital deductible of Part A regenerates again. The Part B, once you reach that 226, that doesn't regenerate. It's the Part A that keeps on, regenerating. There's no limit. So that's why it's always helpful to have either a Medigap or a Medicare Advantage plan to not only cover those deductibles, but also cover that 20%. So in your employer plan, you have a deductible and you have a maximum out of pocket. You're getting double doozy there. They all have that usually, deductible and maximum out of pocket. The difference is between those two is the deductible is what you must pay first before your insurance starts covering. Then the maximum out of pocket is what you're going to pay maximum, and then your insurance goes 100%. So it's always good to look at your employer plans to see, is it worth keeping, or is it worth him going on Medicare Advantage or Medicare, full Medicare,
So
with
if
either a
it's
Medigap or Medigap.
If it's worth keeping, then would he go on to Medicare when he turns 65 as secondary?
Okay, so if you decide to keep him on your employer plan, do not get Part B, because you're going to be paying for Part B when you don't have to. Okay.
You just,
Remember that in the slides where I was saying that if you have credible insurance through your Medicare and it's 20 employees or more, it has to be 20 employees or more. If it's less than 20 employees, Medicare won't recognize it. So you can delay your Part B until he retires, or until you retire, or until you take him off your employer insurance.
But then
So everybody's
he has to sign up for D then. At
No,
65.
no, because you have employer insurance.
Okay.
Your
so
employer insurance should have prescription coverage.
yes.
The only time you're going to get Part D is when you're on Medicare only, the Part A and B. When you get the Part A and B Medicare and you're off the employer insurance, you got to get a D. Okay, you got to get a Part D.
Thank you.
Okay.
see, Medicare is so easy.
Yeah, I know it's
Right?
we got to take it step by step because everybody's scenario is different, and
Yeah.
there's always twists and turns. For instance, she was saying that they don't really have premiums. Okay, well, that's a great scenario. Every employer plan is different, but you do have to be wary about, okay, so what's the deductible? Usually deductibles for employer plans are 3,000, 5,000, just depends. That's where they get you. If there is a very low premium, you can bet your dollar you're going to have a high deductible and high maximum out of pocket.
I
And
think-
that's what's going to get you.
Oh, I'm sorry.
Go
I was
ahead.
going to say, when you're trying to decide, it's also important to see, I mean, we can't really predict the future completely accurately yet, but how often do you need a doctor? How often do you need meds? How many meds do you need? Like, currently, so I think that weigh those expenses versus the premiums and whatever you would need to pay yearly with your new insurance through Medicare. It's just something to compare, to help you decide, if you have, if you need to see the doctor every month or every other month and all these tests and all that, then those add up, so it might be better to sign up for, when choosing a plan for the Medicare, if you were going to go with an Advantage, something like that.
And that goes hand in hand with Medigap plans, because I know Medigap plans, they cost you like, remember what I told you. You have to remember you have 3 premiums with a Medigap plan. You have your Medicare, you have your Medigap, and then you have your prescription drug that you have to pay month after month. Some people, it fits them well because why? because they see the doctor in the hospital every other month. And those are the questions that I ask, is that, you know, if you're predicting that I usually say 2 years. In the last 2 years, how many times have you been to the hospital? How many times have you stayed in the hospital overnight? And, you know, those are the things that you have to take in consideration for the future. Because then I would recommend, you know, let's look at a Medigap plan. You get a Medigap plan, and until you cannot sustain the premiums, then you can get off. Because why is it so essential to make that decision at 65? Is because Medigap plans have underwriting, but that underwriting's canceled or waived for the first 6 months after you turn 65. Remember that we were talking about that? So that's why those are different scenarios when you look into your own medical history. So if you haven't been into the hospital in the last 2 years or stayed overnight, then Medicare Advantage is could be a better fit. But I usually go with the individual of what their value is. And we go over all of that as far as looking at different scenarios, different options. Because again, if you're going to talk to somebody that is an independent broker or agent, because they don't have any sales quotas. I'm not going to push you on a plan because I have to fill a quota. If you're talking to a person from that insurance on the phone, you have to keep in mind that's what they're going to gear towards, is how can I get you on our plan? All right. So I ask question after question, you know, anything from, you know, let's look at your tiers. Do you have any questions about your prescription tiers? Let's go over those. So you can be aware of what your estimated out-of-pocket costs are going to be compared to, let's just talk about, you know, oh, the bells and whistle benefits. That's not the way to go. Don't worry about the bells and whistles. Don't worry about the dental, vision, and hearing, because those are the what ifs. You might use that, you might not, but you're guaranteed you're going to use the prescription drug coverage and the medical. So you gotta review that. Great questions. Anybody else?
Anybody else? Okay, we probably should wrap up, but thank you so much. I know we could talk about this for months and months, so thank you so much, Jean. But anybody else have any question? I wanted to at least have a little bit of time for people to share if they wish to do so. I am going to send out Jean's contact information. He shared it over here, but I'll put on an email as well. Please. I'm sorry?
We get his presentation.
Yes, that's why we recorded it, and it'll take me a few days to get it back out there, but I will send it out because I'm so tech savvy not, and have to figure out how to do this, but yes. And also, if you have any questions or whatever, I know Jean loves questions, right? So you can
Yes,
contact him directly and ask him, you know, set up a time to talk and, you know, more in detail about your situation. So yeah. So, but thank you so much, Jean. And any other remarks, questions, suggestions?
Yeah.
I'm an old retired CPA and it makes our tax code seem user friendly.
Oh, all right.
Well, just keep one thing in mind. There's only one of me, and there's hundreds of you guys. So
Yes,
coming up to October, after October 1st, I will know all the 2024 plans that I can discuss. I know them now, but I cannot discuss them till after October 1st. October 15th is when we can enroll you in a plan to start January 1st. So I always say it's good to just review, and if nothing comes of it and you stay with what you got, at least we check that box that, you know, you know what's out there. But other than that, Lynn, thank you. Dora, thank you so much for having this, you guys. I appreciate it. And I never claim to know it all, but if I don't know it, I'm going to find the answer. That's for sure.
Oh, that's a right attitude. We love that.
Thank
But we
you.
told
Always good
you.
to see you.
All right. Thank you so
Same
much.
here.
You take care.
Thank you.
Bye-bye. God bless. Thank you. Bye-bye.
Bye.